All right, well, good morning. Today we're going to do the rest of the foot and ankle special tests. The first one we're going to do is the eversion talar tilt stress test. Okay, so we're going to have our patient laying in either a laying or sitting position with their legs over the edge of the table, so what we call short sitting. I will be in front of the patient. I'm going to grasp the calcaneus with one hand to maintain neutral at the subtalar joint. And then I'm going to grasp with my other hand right above that ankle mortise, so at the distal tib-fib joint. I'm then going to provide with my first hand an eversion stress at the calcaneus. Okay, so as I pull that calcaneus laterally, providing that eversion stress, I'm looking to see if there is an increased space between the tibia and the talus, so gapping there, or pain. If there is, our pathology is a deltoid ligament sprain. We can also manipulate it just like we did with the inversion talar tilt test to isolate different elements of the deltoid ligament. Sorry. All right, so my patient is going to be in short seated. I'm going to raise her up just so it's a little bit easier for me so I'm not hunched over. I'm going to grasp the plantar aspect of her foot so I have a nice contact point with the calcaneus. And again, I'm stabilizing right above the ankle mortise. Okay, so I'm going to grab with my thumb my index fingers and I'm just going to rotate or roll into eversion. Okay, so I'm looking to see any gapping between the tibia and the talus, and then between the talus and the calcaneus. Any pain with that, Avery?
No pain.
Okay, perfect. So then I can bring her into plantar flexion to get some of the posterior fibers, and up into dorsiflexion to get a little bit more of the anterior fibers. Be mindful as I bring her into dorsiflexion and eversion, I'm also pushing that talus up in between the tibia and the fibula, so that can create a little bit of space or gapping in that syndesmotic membrane, so in the intermediate joint space. Okay. The next test, see, I lose it even when we're practicing. The next test is this external rotation test, and we use this to identify those syndesmotic ankle sprains. Okay, so what you'll have is your patient will sit over the table with their legs over the edge of the table. Again, I'm in front of the patient. I'm going to stabilize the joint above the tibial fibular syndesmotic area. Okay, so again, just above the talocrural joint. My second hand is going to grasp the medial aspect of the foot, so a little bit more through the foot rather than just at the calcaneus. And then I'm going to pull my patient into either a neutral or a plantar flex position. So we'll do both with this one. Then I'm going to externally rotate the foot, okay? So if I can perform in plantar flexion, that helps me isolate the deltoid ligament. As I go into neutral and more into dorsiflexion, I'm pushing apart at that syndesmotic membrane, okay? So a positive test indicates a deltoid ligament sprain with pain, and a positive finding would be pain and laxity, okay? Couple of things to rule out before we do this. So we want to rule out fracture of the medial or lateral malleolus. We also want to rule out injury of the spring ligament. So again, remember the spring ligament runs between the sustentaculum tali and the navicular tubercle. So we'll palpate that and evaluate that before we do this, okay? And then injury to the distal syndesmotic connection or joint. So as we move our patient, especially from a neutral position into external rotation, that's pushing out on the distal fibula, causing gapping of that syndesmotic membrane. So as we do this, again, I'm going to grasp right here, just above the ankle mortise. I'm going to grab the foot, so we're going to start in neutral, and I'm going to externally rotate, okay? So rather than our eversion mechanism, which is with our talar tilt, I'm going to externally rotate the foot. I'm asking my patient if there's any pain. I'm looking for any laxity. Thank you. And then, again, without breaking my back, I'm going to keep Avery moving taller, so I can put her into a little bit of a plantar flexion and eversion, and again, that's isolating a little bit more of those posterior fibers. All right, we also have a modification for the external rotation test, okay? So again, patient's in the same position. I'm still sitting in front of my patient. Again, I'm going to stabilize my leg above, so this one's slightly different. So instead of palpating or grabbing at the distal tib-fib joint, this time I'm going to grab at the proximal tib-fib joint, okay? I'm gonna grab the calcaneus, supporting my ankle in neutral, and then I'm gonna rotate the foot externally, just like we did, but I'm adding dorsiflexion, okay? So this one really looked at that anterior and posterior tib-fib joint sprain, okay? In addition to that, we're also looking to see if there's any injury to the syndesmotic membrane, okay? So if our patient has pain, we're gonna go through kind of our series of steps just like we've done with other tests. So I'm gonna put her in dorsiflexion first, I'm gonna assess for pain. I'm then gonna move into external rotation, assess for pain, okay? If my patient has pain with simple dorsiflexion, remember I'm shoving that talus up into that ankle mortise, pushing the syndesmotic or the distal tib-fib joint. We're creating space in that, which can indicate anterior tib-fib joint sprain as well as a posterior tib-fib joint sprain, okay? So let's do it. Okay, so again, the main modification is instead of holding proximally or distally, I'm now holding proximally. Again, I'm gonna take my patient, I'm gonna move her first into dorsiflexion as far as I can go. Any pain with that? Okay. And then I'm gonna pull her into external rotation. Any pain with that?
No.
Okay. The next one is called the Cotton test, or the lateral talar tilt or lateral glide. Okay, so again, I'm gonna sit with my patient in a short seated position, which Avery is in. I'm gonna sit in front of her. I'm gonna stabilize the joint, the leg above the tib-fib syndesmosis, and then I'm gonna grab the calcaneus and the talus with my other hand. I'm then just gonna do a lateral force to move the talus either laterally or medially. And for this test, we're just moving laterally. So in a couple of slides, we'll do some joint play, and you'll see this is one of the joints that we do joint play with, okay? If there is pain, my pathology that I suspect the most will be a distal tibiofibular sprain or a syndesmotic sprain, okay? Pott's fracture was a fracture identified at the lateral malleolus. So this test was originally used as a fracture test. Its sensitivity was a little bit lower, so it's better as a ligamentous stress test rather than as a fracture stress test. Okay, so I will stabilize my patient. I'll hold my patient in neutral. I'm gonna grasp the calcaneus and the talus, okay? And then I'm just gonna move laterally. And my top hand should just be still, although Avery might feel me pushing a little bit medially on that. And my bottom hand is just sliding the talus and the calcaneus from a neutral to a lateral position. Neutral to a lateral position. You want me to keep on doing that?
One more time.
Neutral to lateral, neutral to lateral. And I want the talus to shift in the ankle mortise, in that talocrural joint. All right, so let's pause there. The next couple of tests are joint play, so we'll pick up with that on the next video. Thank you.